For many years, we've known that alcohol use disorders develop slowly. And there's been great interest in using some of the initial signs of alcohol use disorders to predict which individuals are most at risk for progression. King and colleagues extend research on using alcohol challenge tests. And what these tests do is they expose individuals to alcohol by having them drink it in the laboratory, and they measure the acute effects of alcohol. The important observation from King is that these acute effects, when individuals are followed over time, can predict which individuals are at risk for an alcohol use disorder. And what the findings teach us is that individuals who experience extreme rewarding effects from early exposures to alcohol might be most at risk. And this should encourage clinicians to pay attention to their young patients' response to alcohol, because among people who find it extremely rewarding, we should pay attention to risk for later problems.